1 in 2 women here in the UK are now having a caesarean birth, whether that is planned or unplanned and an emergency. This is worth a watch and a save for all pregnant women, and for more caesarean birth information, hit the follow button for more. And from the previous videos, you can really see just how little information women are provided, and I'm so sorry that you have not had this information ahead of time. Even if you're not planning on having a caesarean birth, then knowing the steps will really help prepare you that if an emergency happens, you'll be able to understand what's happening and why. Now, I'm a midwife, so I'm going to be coming at this from a midwifery aspect. There will likely be steps that I miss because I am not an obstetrician. In a caesarean birth, whether that's planned or unplanned, a midwife is always present in theatre. They are there as your advocate, as your support, and to be able to assist and do some things in theatre that they need to undertake. But it is an obstetrician who is a specialist in pregnancy and childbirth who will be providing that information ahead of time, who will be asking you for your consent to the caesarean birth, and who will be performing the caesarean birth. They will also be the ones to follow you up if any other follow-up is needed after birth. You will have your anaesthetist who will provide the anaesthetic, whether that's a spinal, topping up your epidural, or a general anaesthetic. You will also have the anaesthetic nurse who will be present in theatre, and with the primary obstetrician you will have a second obstetric doctor who will be helping to assist in the caesarean birth. If it is an emergency caesarean birth or there are concerns with your baby, for example being under 37 weeks, there will be a paediatrician who is a baby doctor present at birth. There will be a healthcare assistant or maternity support worker also who will be assisting on the floor, and there will be a scrub nurse as well. Scrub nurses are sometimes midwives in this case. You may also have a student doctor or a student midwife who is in there, or potentially a new healthcare assistant who is learning the jobs of theatre, and then there is you and your partner. Now, the biggest difference between a planned elective caesarean birth and an unplanned emergency caesarean birth is just the time difference. Only other things is whether you've already had an epidural and it just needs topping up, for example, in an emergency scenario, or similarly whether you need a general anaesthetic. So before you get to theatre, you will have seen an obstetrician who would have consented you to the process, the procedure, the benefits and risks. You will have seen an anaesthetist as well who will consent you from an anaesthetic point of view. You will have had medications given to you by your midwife, some stockings put on your legs, a gown put on you, and then you will make your way to theatre. Now again, you will either walk if it's a planned caesarean birth, or alternatively they will wheel you in on a bed. They may also have shaved you too. If you haven't already got a cannula in your hand, this is the time that they will now do that, and that's to make sure that you've got fluids up and running, because one of the side effects of a spinal or an epidural is that it can really drop your blood pressure. That can make you feel very unwell, and it's also not good for your baby either. Once a cannula is in your hand, if you haven't already got an epidural that can be topped up, the anaesthetist will now insert the spinal. Alternatively, if you are unable to have a spinal anaesthetic, your partner will not be present for the caesarean birth itself, but a general anaesthetic will happen at this stage. Once the anaesthetic is effective, this is where either your midwife or alternatively the healthcare assistant or maternity support worker in theatre will now ask you, can I now please insert a catheter into your bladder? This ensures that it's nice and empty before starting the caesarean birth. The reason it's given after the anaesthetic is to make sure that you're nice and comfortable before it's inserted to reduce any pain or discomfort. And the reason it needs to go in is because if you have a full bladder, and as they are making those incisions and making those cuts, if you have a full bladder, it's more likely to be accidentally cut by a knife going in. Bladder damage can happen in a caesarean birth, especially if women have had more than 2 or 3 caesarean births with all the adhesions that can happen inside. But a full bladder means that this is more likely, so a catheter is always inserted prior to a caesarean birth here in the UK. And once the anaesthetic is really effective, everybody comes in. So you've got all the surgeons who are scrubbed up, you've got your scrub nurse all around the table, and then they are going to start the caesarean birth itself. With the exception of putting your catheter in, you should have been kept covered up all of this time with your gown. And then at this stage, this is where your gown will be lifted up, and the obstetrician will come in and they will start cleaning your abdomen with cleaning solution to try and reduce the chance of infection. It goes all over your abdomen, it goes over your pubic region, and then they will leave it usually to dry for a minute or two. Now, in some areas in the UK, they are doing a pre-op swab internally as well to try and minimise and reduce the chance of infection. Infection is an incredibly common complication of caesarean, with 1 in 10 women having an infection after a caesarean birth. And they are currently doing trials and more research, and some areas are now doing an internal swab on a stick prior to a caesarean birth. That needs another video to unpick though. Once the cleaning solution is all dry, what will happen is all the drapes will go up, and this is where now they'll bring down the lights and they will start to focus on the caesarean birth itself. This is normally part where they have done a World Health Organization checklist to make sure that everyone is happy with the procedure, that your consent has been obtained, if there's any allergies or additional steps they need to do. Then what will happen is your obstetrician will start making the incisions. This will go through the skin layer first of all, and what they will do is they will gently open up. That will then reveal the next layer, which is the fat tissue, the subcutaneous tissue. They will then incise through that. Now remember, I am a midwife and not an obstetrician, so this is not my forte in life. Vaginal birth is my specialty as opposed to obstetrics, but we see a lot of them as a midwife. I just want to add, I really hate Play-Doh because I hate that this is mixing. They will now go through the fascia, which is the connective tissue that surrounds the abdominal muscles. And again, this will all come apart, just like so, revealing the abdominal muscle layer. Then what they will do is once they've found the abdominal muscles, they will each place a finger in, thumb inside, and they will pull across. This is where women often feel stretching as that abdominal muscle layers are being pulled apart. Sometimes things like retractors are used to be able to clearly see all the different layers and to be able to give them more access to the abdomen and the uterus. Once they've gone through the abdominal muscles and pulled them apart, it then reveals the peritoneum. This is the membrane lining of the abdomen. And then finally, your obstetrician will reach the uterus where they will make an incision very, very gently until they reach the amniotic sac of the baby. And this is where normally they cut very, very gently because they want to try and avoid cutting your baby accidentally. Once they have got to that part, they will then pop their fingers in and open it up, and that will reveal the amniotic sac, that bag of waters that your baby is swimming in. What will then happen is they will then break the bag of waters, which is where you will often hear a lot of suction and a lot of spillage of waters suddenly going everywhere. Once that bag of waters is broken, this is where your obstetricians will place their hands in and pull the baby out. Very occasionally, they have to place a lot of pressure on the top of your abdomen to be able to help baby out. And sometimes they will even need to use forceps to the head to be able to get babies out, particularly if they're really deeply engaged or there's any other complications with getting baby out. This is where a lot of pressure, and it feels like someone's doing the washing up in your tummy, happens at this stage. Once your baby is out, we will do a minute of delay cord clamping if your baby's lovely, healthy, happy, screaming, crying. Dry your baby off. After a minute, your obstetrician will cut and clamp that cord. Your midwife will bring baby round to you and either do immediate skin-to-skin contact. Alternatively, if you want your baby weighed, checked, vitamin K'd, this is what will happen at this stage. Once this has happened, your obstetricians will then deliver the placenta. Your midwife, once she has made sure that you and your baby are okay, will go and check it, take any cord bloods that may need to happen at that stage. Things like testing blood for rhesus D negative, for example. And that takes only about 4 or 5 minutes if you've never had a caesarean birth before. If you've had a caesarean birth before, there can sometimes be adhesions, which means that the obstetricians need to take a bit longer to get through all the different layers because all the different layers are stuck together as they go in. And then the rest of the caesarean is what takes the longest amount of time for the rest of the caesarean. You'll probably be there for another 20-30 minutes. And that's because what they're going to do is everything in reverse. So they're now going to stitch the uterus back together after having removed that placenta, and also any suctioning and also cauterising of any blood vessels that are bleeding. The more caesareans a woman has had, the higher the chance of adhesions and the longer those caesareans can take to get to the baby. Most obstetricians, once the uterus is back together, will just have a look and make sure that your ovaries all appear normal, and will just check that there's nothing unusual in that abdominal cavity. Once the uterus is closed, they'll bring all the other layers back together, and then they will finish with the skin in suturing that. It is normally dissolvable stitches that are used to bring the skin back together right at the end. However, there are still some people who use staples or proline to the skin, which needs removing later on. This is something else to ask your obstetrician ahead of time, either on the day or if you're having a planned caesarean birth ahead of time, to know what will be recommended for you based on your own medical requirements. And this is a time where you can really bond with your baby. You can take photos. Your midwife throughout the caesarean birth process can take videos and photos for you. This is a good time to have that skin-to-skin contact and see if baby will breastfeed whilst all of those layers are being stitched back up. Once they finish with the skin suturing, what will happen is then a swab on the stick will go internally up through the vagina to be able to clear out any clots. The aim and intention of this is to try and reduce postpartum hemorrhage, because if there are clots that sat right at the top of the cervix, then potentially it can stop the blood coming out and also increase the chance of postpartum hemorrhage. There is also a concern that by leaving clots in there, and especially as you're going to be led down flat for about the next 6 to 12 hours and you're not going to be upright and moving around, there is a higher chance of infection at that stage. So it is normally common practice and common procedure to be able to do a swab on a stick to clear out any clots before they are about to bring down the drapes and finish off. And it is after the internal cleaning that then the suppository of diclofenac, if you are able to take it, is then inserted at that stage. And yes, this is a good time, once the swab on a stick is done, to re-ask you, are you okay to have the suppository of diclofenac at this stage? Reconfirming consent before putting this in. Once that has been completed, what will happen is all the drapes will be taken off, a new bed will be brought in, all the staff will move you from the theatre bed over to your recovery bed. They will turn you side to side and give you a wipe down and a clean, because remember, there have been some things that have painted your skin and it can sometimes change its colour. They'll make sure that you're not sat in a puddle of blood. It will then put a maternity pad in between your legs and sit you on an Inco sheet. And this is another good time to put baby back skin to skin with you as you exit theatre into your recovery area. And if you yourself have had a caesarean birth, you are incredible. Look just how many layers that has been gone through to be able to birth your baby into the world safely. You are amazing, and this really highlights just how long that recovery can be for women after a caesarean birth and why.